Hi guys, welcome. This is our first community conversation in 2 years. My name is Karine Holness. I'm the president of the Jamaican American Connection, and I am here with two of our lovely members, and I'm going to turn it over to Mrs. Kenechia Daley, and she will take this wonderful conversation over. Go ahead.
Wonderful. Thank you, Kay. Good evening, everyone, and thank you for joining us this evening as we begin our series on our community conversation, as Kay just mentioned. I am Kenechia Daley. I am the host for the evening, and it is my pleasure to introduce our guest for today, Dr. Taneisha Grant. So I'll tell you a little bit about Dr. Grant. Dr. Grant is a board certified gastroenterologist who attended the City College of the City University of New York, and she graduated cum laude with a Bachelor of Science degree in biology. She then went on to earn her medical degree from the Albert Einstein College of Medicine of Yeshiva University and graduated with a distinction in medical research. Dr. Grant then completed her internal medicine residency and gastroenterology fellowship at Yale University School of Medicine in New Haven, Connecticut. She completed a sub-fellowship in motility disorders of the gastrointestinal tract at the University of Michigan in Ann Arbor during her final year of her fellowship. Dr. Grant has a special interest in medical nutrition and earned a nutrition and health living certificate from Cornell University. She's a strong advocate for health equity and has worked with various medical and community organizations in an effort to decrease disparities in healthcare and improve overall patient outcomes. She will lead us on a journey of nutrition and health, which will be guided by the topic, how to diet effectively despite all the noise. Dr. Grant, thank you for being here this evening.
Thank you for having me. This is such an honor, especially
Wonderful.
since this is the inaugural conversation after a 2-year hiatus. So I'm incredibly honored. And Jack has continued to, show me all the flowers and give me all the flowers over the years. And so I am forever grateful to Kay and to the entire organization. And Kenechia, thank you for hosting.
Oh, absolutely. Thank you. So before we dive into some specific questions, can you tell us a little bit more about your area of expertise and the conditions that you typically treat?
So my current practice is at Yale University. I am a part of Yale Medical Group, and I am primarily a general gastroenterologist. And under that umbrella, I see patients who have chronic abdominal pain, acid reflux, peptic ulcer disease, celiac disease, some parts of liver disease, such as viral hepatitis. I see patients with chronic constipation, chronic diarrhea. I also treat patients who have symptomatic hemorrhoids, and hemorrhoidal symptoms can include bleeding and itching and pain with bowel movements. So those are some of the components that fall under the general gastroenterology umbrella. My other interest is motility disorders, as you mentioned in your introduction. And under motility, which a lot of people are not very familiar with, falls conditions like acid reflux. Interestingly enough, the GI system is considered to be like a tube, like a pipe. And so things flow as we ingest food from the mouth, they go through the esophagus, the stomach, and through the intestines until they're excreted. The parts of the food that are not, nutritious are excreted as waste ultimately. So you can think of the GI tract as like a conduit or like a pipe. And sometimes things don't flow very well. Sometimes there are hiccups along the way, so to speak. And hiccups is one of the conditions I treat as well.
Interesting.
That was a little bit of an intended pun. So one of the motility disorders is acid reflux, which is actually a motility disorder where the valve that connects the esophagus to the stomach is incompetent. And sometimes that valve doesn't work properly. And so while acid is supposed to be in the stomach primarily, sometimes we can have abnormal amounts of acid that flow backwards into the esophagus from the stomach and can cause GERD or gastroesophageal reflux disease. Acid reflux and heartburn are some of the main symptoms. I also treat patients who have delayed gastric emptying, a condition known as gastroparesis, where the stomach doesn't empty properly. And moving to the bowels, I treat patients with bowel disorders, and the main symptoms of bowel disorders are diarrhea, constipation, bloating, excessive gas. So all of those are considered motility disorders. Irritable bowel syndrome is also considered to be a disorder of motility. So those
Okay.
fall under the motility umbrella. And as you mentioned in your intro, I always felt as if I couldn't do my best job as a gastroenterologist without properly understanding nutrition, because a lot of the conditions that I treat are related to diet. GERD, as I mentioned before, is an abnormality where there's an excessive amount of acid that's in the esophagus abnormally. And there are some foods that can actually weaken or decrease the normal tone of the sphincter and allow an abnormal amount of acid to enter the esophagus from the stomach. And so diet has always been a critical part of gastroenterology. And so I thought it was really critical for my own education and for the benefit of my patients to try to strengthen my knowledge about nutrition.
Okay, wonderful. Thank you. So with that, let me dive into the questions. How did our diets get so far removed from eating recognizable foods from the farm?
Well, I'm from Jamaica. I'll take a step backwards and tell you a little bit about my personal background. We spoke a lot about my professional background, but let me tell you a little bit about my background and how I was brought up. So I am from a parish in Jamaica known as Portland. It's a
Okay.
primarily rural parish, and I lived in Jamaica for 14 years before immigrating. And so in my yard, I had a plethora of fruit trees, not to brag or anything, but I'm giving a little shout out to Portland here. I had lots of fruit trees, orange trees, apple trees, mango trees, guava trees, pear trees, what Americans call avocado. All of those were literally out my door. I could just step out of my house and go into the backyard and could easily pick a fruit from the tree. And I grew up eating primarily whole foods. And so whole foods are things that are recognizable, things that are minimally processed, things like fruits and vegetables and things basically from the farm is a general way of thinking about it. And it was a rare occasion when I ate something that was processed. I grew up and went to second primary school in Port Antonio, and there was a banana chip factory close to my school. And it was a treat to have banana chips. And banana chips are really technically processed. So it was a rarity for me to have a processed food. It wasn't until I moved to the United States that I started eating a lot of foods that were highly processed. The things that are typically considered are chips and sodas and juices and basically what we consider nowadays to be fast foods. And, fast foods obviously serve the purpose. They have a longer shelf life. And so to answer your question, one of the reasons why we've kind of deviated from the farm and gone more towards the factory, as my mother likes to say, is because eating processed foods and foods that are in bags and not literally from the tree is that they have a longer shelf life. And so most persons are not able to just walk outside their front doors and get fruits and vegetables from their yards. They are in more urban areas where whole foods are not as accessible. And so one of the reasons why we've ended up in the place we are is because we needed to improve and increase the shelf lives of a lot of our foods. And so, but I think we've gone, a lot further from just increasing shelf life to having foods that are incredibly highly processed, ultra processed even. Those foods have a lot of sugar. And another big reason why we've deviated so far from the farm is that in order for these foods to be, consumed in quantities is that they have to be very palatable. And one way to make foods very palatable is to put a lot of sugar and to put a lot of salt. And again, the salt and the sodium serves the purpose of increasing the shelf life. But if foods are salty and foods are sweet, it will make you want to eat more. And, a lot of chemicals and additives also make the foods more palatable. But you'll find that you can eat an entire bag of chips and you don't feel quite as full as if you had a plate of whole foods, for
Right.
example. And so you'll need to eat a much higher volume of food in order to be full if you're consuming ultra-processed foods than if you were having whole foods,
Oh,
which were much more nutritious, equally as palatable, I might argue. But you'll need to consume much larger quantities in order to be satiated. And so we, have come so far where we are almost addicted to these processed foods, right? They taste so good, but we'll find that we've gotten to the end of, or the bag, the bottom of a banana chips bag, for example. No shame to banana chips, but personally, I've eaten an entire bag of banana chips and I'm still hungry, right? And it's a complete calorie bomb, but I'm not
right.
full. And so I think some of those are the reasons why we have ended up in the state where we are, which is a state of ultra processed foods that are not satisfying, that have high concentrations of calories, not very nutritious. And I think all of these in combination have led to poor health outcomes. And so, those are some of the reasons why we have ended up in this very distressing state of chronic
Same.
inflammation and poor health.
Yeah. Well, thank you. I am from Jamaica as well, from Manchester, so I know exactly what you mean when you mention you could walk out and pick fruit and get your veggies from the yard. So I certainly can relate to that part of having whole foods more being raised in Jamaica. And so you hit on the point of the foods becoming processed foods being a little bit more addictive. Is it the ingredients that are in these products that makes them more addictive? Is it the salt and the sugar that you referred to earlier that makes it where we want to get more of it, even though we know it's not what our body needs, but we want to get more? Are those the elements that makes it so addictive?
The sugar definitely is very addictive. And there are also lots of additives. And I always laugh that if there's an ingredient on the food that you're eating, when you look at the nutrition label that is unpronounceable, you might want to, reconsider eating that food. So a lot of those additives, we don't always know exactly what they are, but I think they actually contribute to some of the addictive qualities of these foods. And so I always tell my patients, if there's something on that ingredient list that you have a difficult time pronouncing, if you don't have a chemistry degree, in order to be able to pronounce that word properly, then you should probably, reconsider eating that food. So I think the sugar is definitely one of the bigger culprits in
Okay.
terms of the addictive nature of our foods. And, unfortunately, in the United States, the foods are not as regulated. Overseas and in Europe, for example, there are certain additives that cannot be included because the government has banned them. But
Right.
unfortunately, in the United States, we don't have as tight a regulation on the foods that we're consuming. And so we're all victims to mass production and consumerism and things of that sort. But I think perhaps sugar is one of the bigger culprits in terms of the addictive quality of the foods that we're eating.
Okay. Thank you. So in going through and outside of processed foods being easy to attain, right? It's easy to find processed foods wherever you go. What are some of the other deterrents to individuals eating and making healthy choices?
You're exactly right. You might have heard of the food deserts. So sometimes we live in an area that doesn't have a lot of grocery stores that offer healthy food options like fresh fruits and vegetables.
Mhm.
Or I am a big fan of a farmer's market. As I mentioned, I'm from Portland, so my entire upbringing was like a farmer's market, and
Right.
I used to go to Denby with my mother every year. Shows you how old I am if we're going back to but we used to drive to Clarendon every year to go to Denby, which is the ultimate
Yes.
farmers market. So again, if we're not living in an area as immigrants where we have access to foods that are healthy, then that is one major deterrent. Those are the food deserts, as I mentioned. Sometimes, one other issue is that we don't have adequate health literacy.
Mm.
And I mentioned ingredient lists before. And sometimes, when you look at that food label on the back of the packaging, it's like a different language. You don't
Right.
know what to make of it. You don't know what the words mean. If it's not something recognizable, you might not know whether or not it's good or bad, even though you can't pronounce it. And so not even just health literacy, maybe saying health literacy is a little bit unfair because the average person, even an quote unquote educated person, isn't always able to fully comprehend exactly what the ingredients mean. But health literacy is a part of it. Sometimes, we just don't know any better. Sometimes it's what our parents and other relatives have always eaten, and that gets, passed down to the children. And then those children grow up and become adults, and they have children, and then their children also consume a similar diet because they think that's what they're supposed to be consuming because mom and dad and grandpa also
Right.
consume those diets. And so, there's a little bit of education that would be helpful in those settings. So inadequate health literacy is one part of it. The food deserts is another part of it. Sometimes marketing is another issue. Again, not to be discriminatory, but sometimes certain foods are marketed to certain populations more so than others. Sometimes you'll have more fast food restaurants in more minority neighborhoods than others. And so again, some of those things are out of our control. So in the environments that are on the lower rungs of the socioeconomic ladder, will have higher densities of fast food restaurants. And so again, not to completely take all the blame and onus off the individual, but sometimes,
Right.
our societies also really contribute to our overall health. So I think those are some of the factors that actually contribute to poor health outcomes.
Okay. Now, what would you say when it comes to the cost of food, right? So it's a conversation I have with my friends frequently, right? You'll try to get a salad, even if you go to a fast food place and you attempt to get a salad, it may be $9, right? But you can get a sandwich and chicken nuggets and fries and all these processed meals for half that price. Do you think that contributes to individuals making the choices and decisions to go with the processed foods versus the whole food option?
Absolutely. Sometimes, when we're dining out, we are subject to availability and convenience, and we end up eating whatever is available. And I have also fallen victim to this myself. Sometimes I'm at work and I forgot to pack lunch that morning, or I was running late that morning and I forgot to pack lunch and I have to go to the vending machine. And, sometimes there's yogurt in the vending machine, but otherwise, besides the yogurt, there are not a lot of other healthy options.
Right.
But to your question about actually going to a restaurant, sometimes a salad is more expensive than like a fast food meal, as you mentioned. And sometimes, again, cost can be a deterrent. But one of the things that I really emphasize to my patients is that they try to eat more whole home cooked meals. Again, kind of going back to the basics and going back to a simpler lifestyle of farm to table in your own kitchen, right? So preparing your own foods, you have more control over exactly what you're consuming in terms of sodium and sugar and calories and fat content and butter. And all of those things are within your control if you're preparing your foods at home. And so I always encourage my patients to consume foods at home and create your own farm to table environment. There have been numerous studies that show that consuming a healthy diet in the home is not necessarily more expensive than consuming a quote unquote unhealthy diet in the home, right? You mentioned a salad before, but if you take that same salad, you could buy an entire head of lettuce, and you can buy a head of romaine lettuce, for example, and make your own salad at home with cucumbers or tomatoes or bell peppers or carrots or whatever else you like to put in your salad. And you can make your own vinaigrette as a dressing with olive oil and vinegar and some oregano and mustard and salt and pepper, and make your own salad dressing with a side of protein, grilled chicken or grilled fish. If you compare that home cooked salad or home prepared salad with, a restaurant bought meal, I would argue that that salad that's prepared at home is cheaper or not equivalent in price to a restaurant purchased meal. So
Wonderful.
again, there's a lot of discrepancy between dining out. And I think that's where, a conversation needs to be had in terms of not only health, but also cost, right? Because sometimes the fast food is cheaper. But if you are going to the the higher end restaurants or the more middle of the road restaurants, dining out is also more expensive than eating at home. And again, you have more control over what you're eating if you're eating at home. So again,
Right.
go back to what I mentioned before in terms of my um, lack of preparedness and not having my lunch and having to go to the vending machine. If I meal prepped, for example, or if I, spent 10 minutes the night before packing my lunch, those are some of the ways that I can prevent having to run to the vending machine. And that is actually what I've started doing more routinely, so that you're not in a bind and you're not like having to eat because you're famished and have no other choice but to eat what you have in front of you.
Yeah.
So one of the changes that I've made personally is actually to prepare my meal at home and meal prep. So, meal prep is something we talk about all the time, and it's
Yes.
it's very hyped, but I think it's a very good idea in terms of cost savings and health.
Yes. Yes, there has been a lot of conversation about meal prep, and we see videos and we see ways of doing it, and some of it looks so complicated, right? And so but I'm hearing great things, and I'm hearing you say, if you're looking at a processed food, if you're looking at the ingredient package, if you cannot pronounce it, if you have difficulty pronouncing it, then you might want to move on to something else. So I'm going to take that note for myself. Additionally, even if we have the knowledge that processed foods are not good for us, tell us a little bit about the impact to our health by consuming processed foods frequently.
So, and again, just to elaborate on the point you just made about the unpronounceable ingredients, it's not just about the unpronounceable ingredients, but usually the length, the number of ingredients
Ah,
also correlates with the pronounceability, is what I have found. So if there are 5 ingredients on the package, more than likely all of those are going to be pronounceable. But if you start noticing that there are 20 ingredients on that label, ultimately you're going to get to the middle of that list and be able that all of a sudden, you can't quite pronounce those words. So it's not just the pronounceability, but also
right.
the numbers of ingredients as well. So again, many studies have shown that we are suffering as a result of the diets that we're consuming. And the intestines, the human body as a whole is remarkable. The human body is incredible, especially in terms of regeneration. So the body can withstand a lot of insults, right? So we wake up every morning, we go about our days, and we are subject to so many insults from the environment, 24/7, literally. But the human body is remarkable in that it's able to repair itself and regenerate itself. And the intestines in particular are incredibly adaptive and incredibly efficient in terms of regeneration and repair. So the intestinal lining is able to turn over itself every 4 to 7 days. So the lining of the intestines slough off over a couple of days, and those cells in the intestinal lining are replaced by new cells because, again, we're bombarding our intestines with foods and drinks, and stress also plays a role on our intestines. And so again, our intestinal cells are always trying to combat all of these things that is being faced with, right? And so in order to function adequately, it has to be able to repair itself. But there comes a time when we overwhelm the
Mm,
capacity of the intestines to repair itself. And again, because this is a nutrition talk and I'm a gastroenterologist, I'm focusing primarily on the effects of diet on gut health. But I also talk about the more systemic effects of a breach to the gut barrier on our overall health. But again, just to go back to what I was saying before, is that there comes a time when the intestinal lining is exhausted and not
mm.
able to keep up with the amount of information that's coming in on all of the injuries that are coming in on a daily basis by way of the, you know, um, processed foods that we're eating that are very low in nutritional content. And so with the foods that we're eating, the processed foods, it causes damage to the lining of the intestines. And as those cells along the intestinal lining become less able to repair themselves, the barriers between those intestinal cells become a little bit weak. And so instead of those barriers being fully opposed, where they're right next to each other and create very tight junctions, there can be what's known as leaky gut, where the barrier of the intestinal lining becomes more permeable because those cells become a little bit further apart. There are more gaps between the cells in the intestine. And so as those connections between the intestinal cells become less close together and become further apart, it creates gaps between those cells, and the permeability and the junctions become more permeable, and you get what's called leaky gut. And with leaky gut, you can get conditions associated with leaky gut. And those conditions are bloating and diarrhea and excessive gas and, brain fog is what some people will complain about, or irritable bowel syndrome. And, irritable bowel syndrome is its own conversation. There's also disruptions in the hormonal balance that can happen in patients with irritable bowel syndrome. But one of the reasons why leaky gut happens is because of the chronic bombardment of the intestinal cells by these highly processed foods. And so the leaky gut is an inflammatory state. Eating highly processed foods over a long period of time leads to a pro-inflammatory state, so it promotes inflammation. And with inflammation comes chronic illnesses. And many chronic illnesses are thought to start in the gut, especially autoimmune conditions. So autoimmune conditions for like rheumatoid arthritis, for example, are thought to start in the gut. First, you have to have a genetic predisposition. But there's also thought to be some environmental insult or some second hit that causes that gene to become turned on. So we are all genetically susceptible to getting certain diseases, but those diseases may never become clinically relevant, is what we say in medicine, or you may never have symptoms of that disease until that gene is turned on. And one of the ways that gene is turned on is if there's inflammation. And one thing that's been implicated is the food that we're eating and creating gaps in those intestinal cells and in the intestinal lining.
Okay.
So those are some of the ways that chronic diseases can develop as a result of poor food choices.
Okay. And so if food is medicine, how can we remedy the ill effects of a poor diet by changing our diet?
So I mentioned my mom earlier, and she always likes to say, eat from the farm and not from the factory. So I am, again, a very strong advocate of eating more whole foods, more recognizable foods. And I have also found personally that if I'm eating whole foods and less processed foods, I feel better. If I, for whatever reason, if I'm traveling or I don't have access to a grocery store, whatever the reason is why I might deviate from my regular diet and I eat poorly, I feel horrible. Within a couple of hours to a couple of days, I start feeling really fatigued, a little bit of brain fog, bloated.
Yeah.
I find personally that I don't do well if I don't eat well. And again, nobody's perfect.
Right.
I really advocate eating healthily the majority of the time, just for optimal functioning. And so again, we recommend going from factory back to the farm, eating more whole foods, eating more recognizable foods, eating foods that are easy to pronounce. If you do have to eat something that's processed, make sure that you can, it has very few ingredients on that label, that the ingredients are recognizable. And so I think that will take us a little bit closer to kind of restoring health.
Okay. Thank you. Now, what are some of the healthy evidence-based diets? So you've mentioned eating from the farm, going to a whole foods area of dieting or of eating. Are there any other options where you have some healthy evidence-based diets?
So there has been a lot of talk recently about the Mediterranean diet. And the Mediterranean diet is one that I really like because it has a lot of whole foods and I think foods that are very tasty. It's
Okay.
not incredibly restrictive diet. And so I find that it's a diet that's very easily adaptable to anyone's lifestyle really. But I think it's a very friendly diet in the sense that it's not very restrictive. So one of the reasons, and again, I need to define the word diet, because sometimes when people hear the word diet, they automatically think that it's going to be incredibly restrictive and they're eating these like little teeny tiny petite
Yeah.
portions of food, and they can't have their cheat days, and they can't have the oxtail and the, whatever, the curry chicken or whatever else they like to eat. But again, it's about balance and eating healthily the majority of the time. As I mentioned, the 80-20 rule is something that has been proposed. So
Mhm.
eating healthily 80% of the time and, being a little bit more lenient to the other 20% of the time. So the Mediterranean diet has been well studied. And the Mediterranean diet was first identified by the National Geographic fellow, Dan Buettner. And they studied populations from all over the world who lived the longest and who were also the healthiest. And so there are 5 original blue zones, including Okinawa, Japan, Sardinia, Italy, Nicoya, Costa Rica, Icaria, Greece, and Loma Linda in California. So these are all a part of the original blue zones. And they found that persons in these blue zone areas were living very long lives. And it was mostly because they were eating, primarily the Mediterranean diet. And so the Mediterranean diet focuses on 9 nutritious food groups, and even incorporating a few of the elements of this diet into our, routine on a weekly basis can lead to improvements in mental and physical health. And it also decreases the risk of heart disease and certain cancers. And so it's a diet that I really advocate and recommend to my patients.
Okay. So you mentioned blue zones. Can you tell me a little bit more about what that is?
So these blue zones are, areas all over the world where they studied people and they found that, oh my goodness, these people are living into their 90s. Or,
Okay.
there are even people who are living into their early 100s. And they found that these people were fairly physically active, even in their advanced ages. And they had very little heart disease. And they were still very active and enjoying life. And, they had very intact mental abilities and their cognitive function was all intact. And they found that they were eating very healthy diets, mostly diets that were rich in fish and, nuts and olive oils. And so they found that the combination of these diets as well as exercise was contributing to the longevity of these people.
Okay. Now, I do have to ask because I like a balance, right? So was there a similar study? So we have the blue zones. Was there a similar study for areas where the diet was not so good?
I think they found that people who were living outside of the blue zones, they weren't eating as many of those healthy foods I mentioned.
Okay.
Not diets that were primarily rich in healthy oils and fats and nuts, and not just fish. I mentioned fish before, but the Mediterranean diet also included meat, but it has to be lean cuts of meat.
Okay.
And so again, we really recommend that, the diet not be too restrictive, and you don't have to completely eliminate any groups of foods. And so red meat can be consumed as a part of the Mediterranean diet, but it just has to be a lean cut. So you can have red meat, for example, and steak, but it just has to be a healthy and lean cut of red meat.
Okay. Thank you.
Dairy
So we've
can
talked
dairy can also be consumed on the Mediterranean diet. Again, it just has to be in small portions.
more portions. Okay. Thank you. So we've talked a lot about diet and health. Let's talk a little bit about exercise and stress management. How important are those two in maintaining an overall healthy weight and a healthy balance?
So again, so exercise, so it's not about just diet in terms of improving health. But as you mentioned, I think exercise they're kind of synergistic. So you'll find that consuming a healthy diet is better maintained if you're also exercising regularly. And so we recommend 30 minutes of exercise at least 5 days a week. And so with diet, with regular exercise, you'll find that you're able to maintain weight loss if weight loss is the goal of the diet. And again, weight loss is not always the goal of the diet. Sometimes we recommend dietary changes just to improve well-being and how you feel. So again, weight loss is not always the goal, though weight loss can be a positive outcome. And so I always try to shift the focus of my patients, because sometimes patients are really hyper-focused on losing 10 pounds or losing 15 pounds. And I always try to remind them that just, that shouldn't be necessarily the goal. The goal should really be focusing on health and trying to eat more whole foods. So again, if you are exercising, then that's more likely to lead to weight loss and also help to maintain weight loss. But I've also found that if I'm exercising, I'm less likely to eat badly, because I don't want to sabotage the efforts, that I made with my exercise routine. And so I found that if I exercise, then, when I get home after going to the gym, I'm going to think twice about eating that bag of processed food or whatever it is. And that goes to another point. I try not to even purchase those things, because sometimes my willpower is not as strong as it should be. And sometimes I can't help but eat something. That's not so good for me. So even though I say, oh, I'm going to buy it and then I'm just going to treat myself every once in a while, sometimes if I have a very stressful day, I will overeat,
Right.
because we're all human. So I try not to even buy the things that I know are not so healthy, just so that it's not a temptation when I get home and I don't want to sabotage my gym routine. But sometimes we eat because we're stressed. Sometimes, we eat for so many different reasons. And that's another recommendation I make to my patients, that they should keep a food diary. So write down what you're eating for the day and write down what emotions were attached to that eating. Were you eating because you were hungry? Were you eating because you were bored? Were you eating because you were distracted and watching TV and not paying attention to what you're eating? Were you eating because you were sad? Were you eating because you were distracted? So really keep a food diary in the sense of, correlating the food intake with the emotional component, because stress eating is a huge factor, especially during the pandemic that we all just came through. There was a lot of stress eating associated with that. So managing stress, exercise, all of those are ways that we can actually improve or help to maintain a healthy diet. Also not to eat after a certain time, not necessarily to go all the way to the extreme of intermittent fasting, as we've all heard about. But again, just trying to give your body at least a 12-hour period of rest. So again, we have different components of our nervous system. There's the fight and flight component, which is a sympathetic nervous system. And then we have the parasympathetic nervous system, which is mostly focused on resting and digesting. And so again, going back to the cellular turnover and the process of regeneration that I mentioned before, the body needs time to recover. And so I always recommend that, we give our body at least a 12-hour fast. So for example, don't eat between the hours of 8 p.m. and 8 a.m. Just to allow your body some time to recover and to digest the food that you've already ingested for the day, just so that it has some time to recover, right? So again, something as simple as that in terms of making a change, I find is very effective. And again, not just to make it a little bit less overwhelming, I don't recommend that people completely make all the changes at once.
Okay.
And even for this talk, if, the people listening could just take one component of all the things that I've mentioned to start making a change, and then to add things in a stepwise manner over time, so that it's less daunting and it's a little bit more easy to digest and to adapt. A little bit more easy. It's a little easier to incorporate into someone's lifestyle, because sometimes making all the changes all at once can be really overwhelming.
Yeah, I agree. So a lot of times people hear the word diet and they automatically think weight loss, and you kind of alluded to that earlier. What do you say to someone who is not looking to lose weight, who thinks that diet means weight loss? What do you say? What advice do you give to that person to make sure they're maintaining a healthy lifestyle overall, not focusing on weight loss?
For the average person, well, men and women are different in terms of the daily caloric needs. And so the caloric need of a man is different from the caloric need of a woman on a daily basis. But in general, we recommend that persons consume about 2,000 kilocalories per day in order to maintain a healthy weight. And so for people who don't want to lose weight but just maintain, we recommend that they kind of, stick with that 2,000 kilocalorie per day diet. But again, that will change depending on how active you are that day. So again, if you're exercising more that day or burning more calories that day, your calorie requirement will be higher. And so, there's not always a fixed number. You kind of have to, it has to be very personalized. But as a general rule, we usually, tell people to kind of maintain 2,000 per day, and that should keep you stable. Exercise, as I mentioned before, should be about 30 minutes per session, at least 5 days per week. Aerobic exercise is more likely to lead to weight loss. So aerobic exercises are exercises that increase the heart rate. So for example, a brisk walk or, walking at a brisk pace on an elliptical machine or a treadmill or running on a treadmill or a rowing machine, which is my new personal favorite. All of those are more aerobic. Boxing is more aerobic. Swimming is more aerobic. So all of those will really increase your heart rate. And those are more likely to lead to weight loss, especially if you're also decreasing your calorie intake, along with exercising in a more aerobic way. So again, if you are trying to maintain and not lose weight, then again, you have to kind of find that balance between aerobic exercise and food intake. But again, those are some of the things that we recommend in terms of finding that balance if weight loss is not the goal.
Okay. And you mentioned 30 minutes of exercise is recommended, 5 days, minimum of 5 days per week, 30 consecutive minutes. So if I do 10 minutes in the morning, 10 minutes in the afternoon, 10 minutes in the evenings, it's not as effective as 30 consecutive minutes. Is that correct?
Not necessarily. Small little periods of time when you're exercising, I think is also effective. And they will have a cumulative effect. Sometimes I tell, my patients to go for a walk. So if you have a 30-minute lunch break and you have to find time to both have your lunch and go outside, you can do a 10-minute walk and then spend the next 20 minutes having some lunch or making a phone call or whatever else you have to do during that 30-minute time span. But even a 10-minute walk during that lunch break, I think is effective. It's better than nothing. And
Absolutely.
so again, going back to what I said earlier, in terms of making these lifestyle changes less overwhelming, I never, ever tell people that they have to spend, 30 consecutive minutes exercising if it's not convenient for that person. I think whatever is convenient for you and what you will do as an individual is what will be effective. So if you need to break up that 30 minutes into 3 segments, then that's perfectly fine. Especially now that the weather is getting a little bit nicer.
Yeah.
In 10-minute walks 3 times a day. If you're working from home, take a break and go outside and get some fresh air and get your exercise. I think all of those are great options. I mentioned going to the gym earlier, but you don't have to have a gym membership in order to live a healthy lifestyle or exercise. If you're living in a community where it's safe to walk outside, if there are sidewalks outside, all of those are good ways to exercise and not pay a penny.
Right. Absolutely.
So you can, you can take advantage of your community and your surroundings and what fits with your schedule in order to be to live a healthy lifestyle. And there's never any one size fits all, recommendation. All of this has to be personalized.
Wonderful. Well, Dr. Grant.
And sorry to interrupt you, but that's a part of the noise that I wanted to address with this talk. You hear, you see people, especially with social media, and I love social media. But one of the things that we have nowadays that we did not have in the 1980s in Jamaica when I was growing up is social media.
Social media.
And it's fantastic. But sometimes we get a little sidetracked because we're seeing people in the gym for 3 hours a day. Where people, we see people doing all these exercises and they're in the gym and they're working out. And one week it's this exercise, the other week it's this exercise. 1 week it's this diet, the other week it's the other diet. And so there's a lot of noise. And as soon as you think you have it figured out, it's changed. And then there's a new thing. And you're like,
Right.
oh my goodness, I finally thought I had it like, I understood it well. And just when I thought I understood what to do, they've gone and changed everything I thought I understood. And I'm completely confused. And so that was one of the reasons why I titled the talk, is how to diet effectively despite all the noise. Because even for me as a healthcare provider, it's been very confusing. And so I think, again, there's nothing that really applies to everybody. But I think just taking it back to the basics, whole foods, exercise, healthy living, and the thing, a lot of these things I think we know, so again, just to my point of like not being distracted by the noise, trust yourself, trust your instincts, do what feels good. As I mentioned before, when I eat poorly, I don't feel good. I feel, I feel sluggish. I'm not functioning at my best. So again, just listen to your body. Do what fits with your lifestyle. But again, just make sure that you're consuming whole, healthy foods, limit the processed foods, exercise regularly, and make it a part of your lifestyle. Exercise with a friend, go for a walk with a friend. If you have a dog, take the dog for a walk. We can do our reggae Zumba classes
Yeah.
last year. So again, do some reggae Zumba, dance around your living room.
Yeah.
You mentioned 10-minute sessions before if you're, getting ready to go out or something and you're cooking before you leave the house, they say jog in place. They have these things where, so whatever fits into your lifestyle, just make small incremental changes if doing the big overalls is too overwhelming for you.
Wonderful. Thank you so much, Dr. Grant. I think that's a nice way to conclude the program. And I want to thank you on behalf of the Jamaican American Connection, I want to thank you for the time that you've spent with us this evening. I know I have certainly learned a lot. I know that there are choices and decisions I have to make sure that I get on a better health pattern. And so thank you so much for sharing your time, sharing your expertise with us. And thank you, and enjoy the rest of your evening.
You are very welcome. And I just wanted to give a final plug because I am a gastroenterologist and because this is March, I just wanted to make a little plug for Colorectal Cancer Awareness Month, which is, March is dedicated to Colorectal Cancer Awareness Month. And so a part of my job, which I didn't mention before, as a general gastroenterologist, is that I am a strong advocate of colorectal cancer screening and prevention. And colonoscopies are one option for screening, but there are several non-invasive options using stool-based tests that are as well. And we are recommending that screening begin at age 45 instead of age 50. And so I just wanted to make a plug during this Colorectal Cancer Awareness Month to go out and get your colorectal cancer screening if you are at average risk and if you were born in 1979 or after. So if you're born in 1979 and beyond, then it's time for you to get your colonoscopy if you have not. So that's my little plug.
Wonderful. And that sounds like a session for a topic for a future session as well. So we could probably delve into that a little bit more. Again, thank you for your time. Thank you for sharing so much information with us, and you enjoy your evening.
Thank you. Thank you for the questions. Thank you for the great questions. And thank you for having me. Enjoy your evening as well.
You as well. Thank you.